Good afternoon. Thank you for joining us for this final installment in the School of Public Health series of examining the intersection between climate and health. So far in this series, we've explored the links or the associations between climate change and infectious diseases, and we looked at the burdens of extreme weather on health and the well-being of populations around the world. Today, however, we're going to take a step back and think about why many climate and public health experts believe that climate change is a public health emergency. And we'll actually also try to think about what do we do about that. Climate change is a growing challenge that continues to impact all of us. The World Health Organization predicts that climate change will cause over 250,000 additional deaths each year from malnutrition, malaria, and heat stress alone. In the United States, the American Medical Association has declared climate change a public health crisis that affects all Americans. The 2020 Lancet Countdown Brief for the U.S. identified key findings. In 2020, around 32,000 Americans died due to exposure to air pollution. Heat-related mortality for people over 65 has increased by over 74% in the last 5 years. The duration of malaria transmission season has lengthened by nearly 40% in U.S. lowland areas. Climate change and healthcare are exactly the sort of complex issues that we'd like to take on here at Brown University, and as you'll hear. So let's meet today's multidisciplinary panel that brings together experts from across Brown to discuss why climate change is a public health emergency and what we can do to help mitigate and respond to the impending issues. So today we are really graced to have an impressive group of folks to participate in this panel. We have what I would say is climate science royalty. We have Kim Cobb, who joined Brown in July 2022 as the director of the Institute at Brown for Environment and Society, or commonly known as IBIS. She was also recently appointed to the Biden administration's President's Intelligence Advisory Board. Now, Kim has a very long and voluminous bio sketch. I'm not going to spend, you can go to the website and read that in detail, so I'm not going to spend too much time. But I also want to say that the fact that somebody who is as accomplished and as knowledgeable and intelligent as Kim serving on an advisory panel gives us a little bit hope that things that might actually get done. Also, we have Dr. Irene Papanicolas. Irene is a health economist and health services researcher who joined the Brown School of Public Health faculty in the Department of Health Services Policy and Practice in 2022. Her research is focused on assessing the performance of health systems and furthering the use of health system comparisons to draw insights for national policymakers. And unofficially, because it'll come out officially soon, Irene, her center proposal was voted on and approved by the Academic Priorities Committee yesterday. So, big things that are going to come out of Irene's shop for sure. And finally, we have Adam Levine, who is a professor of emergency medicine and in the School of Public Health on the Faculty of Health Services Policy and Practice. And he's also the director of the Center for Human Rights and Humanitarian Studies at the Watson Institute of International and Public Affairs here at Brown. Adam also serves as the chief of the Division of Global Emergency Medicine at the Warren Alpert School of Medicine. So that's the lineup. And so let's start the show. So Kim, I'm gonna start with you. Okay. Frame for us a little bit about the current situation of climate with an emphasis on what that means potentially for health.
Well, that's a big question, but I guess I'll start with some of the big answers that we do know from climate science, and then try to drill down on an example that I think illustrates the vulnerabilities that we already have today, let alone those that are going to be growing going forward. So we know from the Intergovernmental Panel on Climate Change Assessment Report that I took part in, as well as Baylor Fox-Kemper there in the audience, lead authoring a chapter as well. We know from the latest science synthesis work that we are really at the precipice of blowing by a 1.5 degrees Celsius warming target, which is going to come in the next 10 years or so, on our way to a 2 degrees C global warming in the near term, and with the opportunity to really turn that warming trajectory around, perhaps by mid-century, and reserve the right to begin cooling later this century. So that's kind of the emission stakes where we are at right now. And 1 degree, 1.5 or 2 or 2.5 sounds like small change when we have weather out there that is swaying 20 degrees Fahrenheit every day this season. But what we do know is that for every increment of warming, we're baking in more and more health and weather extremes, and we know this from the science synthesis from the Intergovernmental Panel on Climate Change. So what kinds of climate and weather extremes are we talking about here, and what do we already know about the impacts on the ground for public health? So heat waves are the most obvious consequence of warming, and those are some of the ones that are indeed the most deadly, with, of course, heat waves already causing catastrophic losses in this country every year, as well as around the world. But it's also about extreme rainfall and the flooding that you're seeing in headlines like Fort Lauderdale just recently, of course, and other more catastrophic losses in the Rhine several seasons ago as well. We're also talking about agricultural drought. It stresses to our freshwater delivery systems and supplies, and associated agricultural throughput and productivity around the world. And of course, wildfires, which are grabbing the headlines almost year-round now in wildfire-prone regions. And so I wanted to highlight an example from the extreme heat landscape, just to illustrate the losses that are at play here and how they're accelerating so dramatically going forward. So in July 2021, we all saw the headlines around the Pacific Northwest heat dome event that was 3 days of kind of out-of-this-world heat that baked an entire multi-state region in scorching temperatures. Now, this was predicted, very well predicted by meteorologists, but it still caused hundreds of deaths during those 1-week interval that actually rivaled, or in some states exceeded, the weekly death rates from COVID-19 that preceded that summer's event. And so we can think about heat-attributed deaths are difficult to make, but that's just one example. Now, we can do with science is go in and actually diagnose what is the role of greenhouse gases in tipping the scales for that kind of heat wave. And this is where I think we can get some exquisite answers from our best tools in climate science. And what we know from going in and fingerprinting the role of greenhouse gases in that specific heat wave is that we're already dialing up by 1,000-fold the chances for that kind of heat event to occur on our planet from the pre-industrial era to today, from the rise of greenhouse gases. But that's not the most sobering thing. The most sobering thing is that going into a 2 degrees Celsius warming world, which again is almost certainly baked into our next couple decades, we're talking about that exact sequence of temperature, scorching, deadly events becoming a 1 in 5 or 1 in 10 year event. So again, a 1 in 150,000 pre-industrial, 1 in 1,000 today, almost impossible, but becoming fairly common within the next couple decades. And that's not just one place, right? Every summer we play a roulette wheel around the world with what community is going to land in the line of fire today. And I want to end by noting it's not an equal opportunity killer, of course. This kind of climate change emergency, public health emergency, is a health justice emergency at the end of the day. And so the people who are succumbing to these extreme heat waves are really the low income, often communities of color, the senior, the very young, those people who are already subject to such gross health disparities, and that will accelerate going forward.
Thank you, Kim. Adam, how are you seeing this play out in the clinical settings that you're in, both here in the U.S. as well as in your global work?
Yeah, thanks. So I teach a course on human security and humanitarian response, and one of the things we spend a lot of time talking about is natural hazards. And I like to divide up the consequences on human health of climate change into three broad buckets. So the first is, as Kim was talking about, an increase in the severity and frequency of natural hazards. I use the term natural hazard as different from a disaster. A disaster is when a natural hazard overcomes a community's ability to cope. So a hurricane is a natural hazard. A hurricane that destroys a village is a natural disaster. What we're seeing, according to the data that the Center for Research on the Epidemiology of Disasters keeps, is a sharp increase in the number of disasters each year around the world caused by natural hazards. And they have data going back 100 years. They define a disaster as a natural hazard causing the death of more than 10 people or affecting more than 100 people. And if you look at their numbers, it's pretty flat. The early part of the 20th century starts to increase and then increases really sharply towards the end of the 20th century into the 21st century. And that's a factor of a couple different things. One is climate change. Most of those increases in disasters are meteorological disasters such as storms and flooding. But it also has to do with population demographics. So the population of the world is increasing and increasingly concentrating in urban areas, and those urban areas are located on coastlines. It's kind of the opposite of adaptation. Every day, millions of people around the world are moving right into the path of natural hazards that we know are going to become more frequent and more severe into the future. And interestingly enough, it's not just storms and flooding, though those are, of course, the biggest ones we think about. Climate change, in fact, impacts all different types of natural disasters, even earthquakes and volcanic eruptions, if you can believe it. The important piece with this is that natural hazards cause direct deaths, but they also cause a lot of indirect deaths and indirect suffering. And that's what we see in every type of disaster. There are going to be the individuals who are directly killed by the heat wave, who are directly drowned in the flooding. But then there's also the woman who's trying to give birth but can't get to the hospital now because the road's been washed out. There's going to be the individual who's suffering from a chronic disease. This is what we see here in the US a lot during heat waves. Every time I'm working in the ED during a heat wave, I might see a handful of people who come in with actual hyperthermia or heat stroke, but more than that, I'll see a lot of people coming in with congestive heart failure or exacerbations of their COPD. So these chronic conditions that they have that are made worse by the effects of heat, for instance. The second broad bucket is famine and drought. And this is also, of course, a natural hazard, but one that's much more insidious, and as a result of that, less likely to play out in the media, and as a result of that, less likely to raise the funds that like an earthquake or a hurricane event will raise. And so this is especially an issue. We think of famine as being, a biblical problem, maybe something that you heard about in the 1980s when you saw starving children in Ethiopia during the Live Aid concert. But in fact, actually, this year we have the highest number of people in the world suffering from what we categorize as crisis-level hunger conditions. Over 200 million people in 2022, which is the highest number we've ever recorded. And that, again, is a factor of climate change impacting droughts and crop failures. It's a factor of the war in Ukraine impacting the delivery of wheat and fertilizer and fuel to Africa especially, and its lingering effects of locust infestations across Africa and the COVID-19 epidemic. The third big bucket that we have is infectious diseases, and there's the obvious case, you think about mosquitoes that carry malaria, dengue, Zika. Their habitat is expanding because of climate change, both to higher altitudes as well as to higher latitudes, which means that more people can be infected. But even beyond that, heat has a way of impacting severity of all different infectious diseases. And this is actually some research that I've been doing. I did a number of research studies during the West Africa Ebola epidemic in 2014, 2015, mostly looking at new treatments and diagnostics for Ebola, but we had data from all of these Ebola treatment centers across Liberia and Sierra Leone, and I had a med student who was just interested in saying, let's look at, how heat affected mortality, and I'm like, okay, sure, go for it, here's the data. And surprisingly to me, maybe it shouldn't be now, we found that on days when the temperature, the ambient temperature, and we got this data from NOAA weather data linked to the location of these different Ebola treatment centers. When the temperature went above 27.5 degrees Celsius, the mortality increased sharply in these Ebola treatment centers. In fact, 70% mortality when it was above that number and 50% mortality when it was below that number. 50% mortality is still a lot. Ebola is a very deadly disease, but 70% is certainly much worse. More recently, Kate and I actually have a supplement from the NIH to look at climate change and health on one of my research projects looking at sepsis, which is severe infections in children in Bangladesh. And again, very surprisingly, when you have temperatures going above 30 degrees Celsius, we see a sharp increase in the rates of sepsis. And this is particularly interesting because sepsis is not a specific infection. It's not like pneumonia, it's not like diarrhea, it's severe forms of all infections. And we see that going up with heat. And so we have this huge impact on health that we know from climate change. And I think the next piece of the question, which maybe we'll get into in a little bit, is what can we do about it? As Kim was saying, we are blowing past 1.5 degrees, past 2 degrees. Of course, every 0.1 degree that we can limit it is going to be important. But I do think that we really need to start from a global health development point of view and also from a humanitarian point of view, thinking a lot more about adaptation. And just a couple examples before I stop talking of what that might look like. So number one, just from my own data that I was talking about in the Ebola treatment centers in West Africa, we did a subgroup analysis looking at patients who were treated in Ebola treatment centers that had hard cover, that were made that had tin roofs, that were semi-permanent structures, and compared that to patients who were treated in Ebola treatment centers that were temporary structures, mostly tents. And the ones who were treated in the hardcover structures had no increase in mortality based on temperature. The ones who were treated in the tents had the sharp increase in mortality based on temperature. So this is just a small thing that we can think about in humanitarian response to future pandemics or any type of crisis, the type of materials we use to build shelters, the type of materials we use to build health facilities, et cetera. In 1970, a large tropical cyclone hit Bangladesh. It killed 300,000 people. It was the largest mortality of any tropical cyclone in history. And in 2020, 50 years later, a tropical cyclone of the exact same severity, exact same wind speeds, 150 miles per hour, hit southern Bangladesh and killed 128 people. And the difference in that 50 years is that Bangladesh set up incredible early warning systems. They were prepared for the cyclone before it hit. They evacuated 2 million people into more than 12,000 shelters. They brought out the 2,000 Army teams, disaster management teams. They had several thousand medical teams pre-placed. They brought out 25 Navy warships in order to help move people out of harm's way. In fact, I think that this is going to be what we use our militaries for in the future, is actually protecting us from the effects of climate change, which is probably a better use than fighting wars. And so those are some examples of the way that we can think about building adaptation into global health and into humanitarian response that can perhaps mitigate some of these effects.
Thank you. So this sort of leads very nicely to the work that you do, Irene. And I know some of your work focuses on measuring health system performance and how climate change will affect health systems. So the question is, how should health systems be thinking about, why should they be thinking about climate change, and how should they be preparing for that? And how do we think about, from a policy or a community perspective, to help position health systems to be more responsive to the impact of climate change?
Yeah, I think as we think about the relationship between climate change and health systems, I'm going to outline 3 kind of distinct ways we can think about it, but I think that are all important and come together. The first, I think, building on what Adam was talking about, is how climate change impacts health and the disease burden that we face and how that's changing. So, I mean, we heard a lot about different ways that climate change and global warming can influence all sorts of diseases. It's been linked to cardiovascular mortality, cerebrovascular mortality, respiratory disease, the change in infectious diseases, even occupational safety the deaths from occupational deaths go up on hotter days, both indoors and outdoors. We also have kind of indirect changes in terms of the disease burdens that population have to deal from that are related to economic and social factors that have to do with climate change. I think in the first panel there was a discussion about migration and Lake Chad and migrants coming to Southern Europe. If you think about then these movements, again, that's changing the populations that health systems have to deal with that might be different from populations that they've historically had to deal with or have to respond to migrants in different ways. So that first relationship is that about how climate change impacts the health outcomes that health systems are looking to deal with. The second is the effect that health systems have on climate change. So health systems, I think, account for 5% of global greenhouse gas emissions globally, and that is not equally distributed. High-income countries contribute more of that. I think the U.S. is at about 10% of greenhouse gas emissions. The U.S. healthcare system, and so one thing that we need to think about in terms of health systems is how do we become part of the solution as well, not only by treating the people who are affected, their outcomes are affected, by becoming less of the problem, right, and moving. We've seen commitments made, for example, at COP26 from a lot of systems stating that they're committed to climate resilience. There's some health systems like the UK NHS that have made commitments by, I think it's 2050, to be a zero contributor. So those are the types of things we can look for as health systems look to become part of the solution as well. And the third way, I think, to think about this relationship between climate change and health systems is the disruption that severe events have on the delivery of health services. So when you have kind of heat waves or flooding, that can destroy a lot of the infrastructure that's used to provide care, so clinical buildings, even roads and transport that people need to go to access care or health workers need to go to provide care. And these disruptions aren't necessarily in the days only that the disaster is ensuing, but can take months to fix, therefore disrupting access for a long period of time. If we think also of the investment that needs to go to fix these resources, that could also be taken away from providing health and could think of how it's contributing to affordability of care as well. So there's these three distinct areas. If we think of the first, the health outcomes, and the second, kind of the delivery of health services, those are key things that we think about when we measure the performance of health systems, right? If we think about what are the goals of some of health systems, it's to improve or maintain health outcomes. It's to do so in a way that's equitable. Both of those buckets speak directly to health systems being able to do that, right? Being able to adapt to meet the new health needs of the population, and also being able to preserve their infrastructure to do so in a way that's using resources to improve health rather than directed at fixing these disruptions and taking away from that. I guess the second area, how health systems are contributing to climate change, is something that health systems, we need to make commitments as, governments to become part of the solution as well. And I think this is hard because it's a global problem. It doesn't fall on every health system equally. The health systems that are the biggest emitters are not necessarily those that are facing the biggest consequences. And so, as with any global problem, how do we create global action in a way where people become part of the solution, not only because it benefits local boundaries, but because it's for the greater global good, and we get, the high income systems to also think about how they can reduce emissions to benefit countries that are still trying to achieve universal health coverage and are still investing in the system but emitting quite less.
So you really sort of touched on an interesting issue, because in a single payer health system, there might be things a little bit easier to do perhaps than in a fragmented one like we have in the U.S. How do you prioritize or incentivize sort of a fragmented health system like the United States to move toward preventing the problem? Your second bullet, and you can jump into this as well, Kim, because I'm sure you have some perspective on this. So start with you, Irene, and then Kim.
I think, I mean, the way, obviously there's systems like the NHS, which is highly centralized and have the ability to set a target and then, do everything in their power to meet that target, which is different in systems like the US, where you have, well, it's not just one health system, but multiple health systems. I mean, in the US, I think it's Kaiser has already made a goal to address particularly scope 1 and 2 and try to reduce their emissions. But yeah, how do you get everybody on board? But if you think about it globally, it's a problem of global fragmentation, right? Every health system needs to commit, not just health systems within a nation, because every health system is contributing to the problem. So even if the UK has the ability to fix, I guess, the UK emissions, that's not going to solve the greater problem. And so we have this broader coordination issue, both, I guess, within countries, but also kind of more globally. And I think there's maybe a few lessons from even health system comparisons. How do we create metrics to embed into, I guess, maybe national or international frameworks that we look at, like the SDGs, where we monitor and hold countries to these pledges of, if you're going to become carbon neutral, what are you doing to achieve that, and what are the metrics that we can do to measure these to ensure that we're monitoring and holding, I guess, countries to account, really. Yeah. And it's at that level then maybe that we can see action even within countries amongst different health systems, like the US and in different parts of the fragmented health systems.
Yeah, I'll take a stab there in thinking about, looking over the last 10 years of where climate action has occurred and where the big momentum is right now, and where I think, frankly, all the action and much of the hope is really in the private sector, thinking about, how they can step up in a leadership role here. And, this is not all about like altruism and unicorns. This is because it makes business sense. To do so increasingly, not just because of branding and marketing concerns, but also because of kind of the carbon liability space, frankly. There are emerging global markets for carbon. The United States has been, digging in its heels down that trajectory, but it's coming. And so, for example, the fact that the Securities and Exchange Commission is very soon going to mandate carbon disclosures as part of all companies, for example, privately held entities, is a huge signal to these entities, even in the US, where we have this fragmented kind of profit-driven system. So to me, that is coming down the pike. It's yet to fully mature, but those entities who aren't thinking outside the box about how they can step into a leadership role here, they have everything to win and increasingly so much to lose by being out of this conversation and not taking a leadership role. So that's what I would say to this. And by the way, electricity prices are only going in one direction. So, better, the sooner you can get a grip on that, the better it is also for the bottom line.
Very good. So there are a broad range of issues that we've identified today. What can we do at Brown to address some of these, both as a research institution, but also as a community, and how we sort of serve and impact the state of Rhode Island, as well as the rest of the U.S. or the rest of the world? I'll start with you, Kim.
Oh,
then we'll go to
I was going to
Adam.
throw it to Adam. Wow, I mean, we could do so much. I could go on and on, but I will try to, keep it succinct. Brown has such a global leadership role to play. We have a local, regional leadership role to play. And we have this really amazing nexus of experts who are already coming together. And I'm really excited to be working on initiatives with Adam and so many other people in the audience here. One in particular is called Equitable Climate Futures. And Ron, you also have been a partner on this, in thinking about how we could recognize kind of a place-based model for climate change solutions development that explicitly has a big pillar on the climate and health space. And so what does that actually really mean? I think what that really means is activating and sustaining and developing partnerships between academic experts and teams of folks from this campus with external stakeholders, and not just policymakers, but the community experts who can bring their expertise into helping us understand what does it mean to survive a heat wave in Providence today? And what could it mean to develop solutions with your community, both in the near term on the emergency planning and response side, on the treatment and access issues to the health system, but also in the longer term, what does resilience look like to you from a climate change lens? What do you have to win? What do you have to lose? What can we learn from these experts? So building these teams is not an overnight thing. It's a long game, but it's a very strong play to make. And it's really one that recognizes we can't do this alone. These are systems level challenges, and they do require systems level solutions that require us to look beyond the walls of our campus and these sustained partnerships. I'm really excited about where efforts like that would go, and I'll let my fellow panelists weigh in further.
So Adam, pick up on that and also talk about how we can impact things globally as well, given from your perspective, because you have a pretty probably have the broadest perspective. I don't know, maybe Irene does too, but anyway, you have a pretty broad perspective.
Well, I think that that's absolutely true. We have to both think globally as well as locally. So one of the great things about being in Rhode Island is that it's a small state and a very blue state, and so we have incredible opportunities to experiment from a policy perspective and to be at the forefront of passing new legislation in the state that really shows other states around the country and perhaps other places around the world what is possible. I think it's super exciting, for instance, that Rhode Island basically is going to be hosting the creation of the largest wind farm in America coming out of this state. And we have the opportunity, as that gets built over the coming years, to show how that gets done. On the healthcare side, as was mentioned, there are ways that we can reduce the carbon footprint of our healthcare system here in Rhode Island, and there's a number of folks, including those in this room, who are working on that, even now with Lifespan and Care New England and so forth. On the adaptation side, I think it's also important for us to think about what that is going to mean in the future for Rhode Island. We're a state that literally is 3% larger at low tide. So what does it mean when we have some very high tides in the future? How is that going to impact people's ability to access hospitals? How is that going to impact the functioning of our hospitals? Are we ready for a major hurricane to strike this state? Are our healthcare systems still going to be functioning? Those are things we need to think about. On the global scale, the problem gets much bigger. And, again, we'll turn towards issues around adaptation. This might be a controversial thing to say, but I believe that, air conditioners are the mosquito nets of the 21st century. Literally, people who live in parts of the world like sub-Saharan Africa or South Asia who are going to be affected by heat waves of the type and worse that hit Portland are going to be subjected to temperatures that are not compatible with human life. And in fact, we know that once humidity goes above 100% at a temperature of 35 degrees Celsius, 100% of people will die within a few hours. That is way worse than Ebola, which is only 50% mortality. The only way for those individuals to survive is going to be air conditioning, and that's going to mean figuring out how we can get cheap, sustainable air conditioning into those homes, which hopefully also doesn't make the overall climate picture worse by increasing the need for burning oil and coal to produce the electricity for that air conditioning. Hopefully, a lot of it can be solar. But those are the types of problems, and it's not a simple problem. We're talking about 1 billion air conditioners in Africa, another 1 billion in South Asia that need to be installed in people's homes in order to protect them from the effects of climate change that we're going to see on a much more frequent basis in the future. On the disaster side and humanitarian side, a lot of the talk right now is around financing, which is incredibly important. Anticipatory financing is one of the newest things that people are talking about. You see a hurricane, tracking it, heading towards the Philippines. Why do we wait until it hits the Philippines to send the money? Why don't we send the money 3 days earlier so that it can actually be in place and spent when the hurricane strikes. And so anticipatory financing is something actually that the UN has moved a lot in recent years towards. Cash-based financing allows us to get funding very quickly to places after a disaster, as opposed to trying to move huge amounts of food and supplies that also require a huge amount of carbon footprint to move them to places. So there are ways that the humanitarian system can adapt to a future of climate change and be more efficient in their responses as well.
So, Irene, how do you see the work out of the newly minted center sort of weighing into this as well, in terms of what we can do, not only for here at Brown, but also for our students and for the population of Rhode Island as well as beyond?
Yeah, so I think one thing that's been interesting coming out of all of these panels is also what we can learn about other problems that have required kind of global coordination and global action. I mean, I think in the first discussion there was what can we learn about pandemics, what can we learn about other humanitarian crises where we need to mobilize global resources. So I think the research around those areas and applying all of that learning and those lessons to this global crisis and thinking about what are the lessons learned and how can we begin from what we already know to look at that. In terms of adaptation, can we look across at different areas? I mean, there was the example about the in Bangladesh and the response more recently and how effective that was because of all of these different things. And I was reading in this weekend even about, I think there was a heat wave in Mumbai during a political rally where you had a lot of people outside exposed to the direct heat, and all of the lessons and failures learned about how there wasn't enough communication about the heat wave, enough resources available for cooling centers, access to water, lack of clear accountability as to who is meant to reach out to engage all of these different stakeholders to provide the right action to inform people, identify vulnerable people, get the resources to them to mitigate kind of the effect of a heat wave or any other kind of climate-related event. And so I think if we can learn from lessons from other places and look to other countries, how have they successfully kind of incorporated surveillance, communication, identifying vulnerable communities, getting resources to them? Because often it's not just the health system, it's the health system working in health and all policies and communicating with local stakeholders, with meteorological agencies, with measurement. And so looking to effective models from different types of climate-related shocks, about what are these effective strategies, how do we hold how do we find somebody to hold accountable so that we can ensure that somebody is responsible in taking those actions to ensure we have good health and all policies and communication and learn from adaptation.
So Kim, the thing that I think about a lot is how do we sort of reimagine our curriculum so that we are training from our perspective, every student in public health, probably from every student on campus, to have some basic foundational knowledge about the impact of climate and particularly for us, climate and health. I mean, where do we start? And we should do that relatively soon.
Yes. Yes, I mean, I think this came up in the other panels very clearly as well, and I don't pretend to have all the answers, but I do know that what I sense on this campus since my arrival is just a huge appetite, from our students for this kind of content, for this kind of training, this literacy, and also the concrete skills that would enable them to plug in to part of the solution machinery, no matter where they land, whether it's in finance or law or public affairs or climate. And so thinking really creatively about, as we develop these amazing research capabilities and we take them those next steps forward, how are we bringing our students with us should be the question that we're asking ourselves, and we need to answer that in real time, not with a 5-year lag, because
right.
This is already 5 years, 10 years lagged from this yawning realization how far behind we are with this problem globally, but also as an institution of higher education, and I mean as a sector, not just Brown. This is sector-wide challenge. And so I think a couple things are important here. One is to kind of systematically and purposefully dismantle the model of competition between institutions and who can have the best program in XYZ and all the bells and whistles and awards, and think about rapid innovation and entrepreneurial cycles that are built into how we go about this, so we can quickly fail, quickly learn, quickly borrow, and really be in a fundamentally different place in 5 years. Because if there's one institution that's slow to change, it's higher ed, but we don't have the luxury anymore. So I think it's going to be about not just working across units at Brown like we're doing with this amazing set of panels and new conversations, but also looking to our neighbors in the region and partners around the world who have some great things going, and getting that ported over, piloted, and where it's successful, institutionalized as quickly as we can. But I want to make sure that we're clear that this will take sizable investments as well. This innovation has to happen in a different way than curricular innovation tends to happen in an institution of higher education, because we are going to have to challenge disciplinary boundaries. We're going to have to bring our students very quickly into real-world experiential learning settings where they can gain cutting-edge skills that are being developed and rapidly cycled through in a 2, 3 year, 4 year time frame as this landscape changes almost yearly now with respect to the economic landscape, the technology landscape, and the vulnerability landscape as well. So those are some lessons that I'm seeing from talking to people on this campus as well as outside this campus. And I'm really excited to think about what we might do to take these first steps. I think the most obvious thing is to make sure that we are getting our students deeply involved in these research enterprises. We are offering them as many opportunities as we can to get involved in that machinery, and that's something Brown does already very well. And with the development of the Career Lab and the deep investments Brown's making in that landscape, what would it mean to have a climate health component of that, where we could purposefully use that nexus of partners and student appetite to help drive us in that innovation pathway?
And I'll add, at the medical school, there's efforts underway by some of my colleagues like Kyle Martin to try and integrate climate and planetary health more broadly into the medical school curriculum, because the physician of the future, sadly, is going to have to take into account the climate-related risk factors that their patients have when understanding their patient's risk for disease.
That's great. That came up at the last panel too, so that's a consistent. I think that the challenge for us is to try to figure out how to make it not as an add-on, but as part of the fabric of whatever we're teaching. Mm-hmm. So I'm going to take some questions from people who had pre-submitted questions, then we'll open up to the audience. This question came up twice, so I'll take this one. As climate change has increased many health problems, as you all so well articulated, what is the one major intervention that if the entire world adopted would you recommend that could have the biggest impact to improve public health? Just one thing.
Vote. I mean, that is my answer. I don't know. Y'all have something better?
Where that's allowed, right? Where people are able to. Yeah. Wow. I mean, that's really hard to have one major intervention. But, I'll tell you where I come to this from. I consider myself a pragmatist. I'm not an optimist. I'm not a pessimist. Your cup is not half full and it's not half empty. It's exactly twice as large as your available water supply. So what you need to figure out is, do you need such a big cup, or can you sell it, buy a smaller one, and purchase a little bit more water? So I think that, as mentioned, there's going to be a lot of areas where we're going to have to do adaptation in order to limit the negative effects that climate change is going to have. And it is going to have negative effects no matter what we do. More people are going to die because of it than would have died without it. But what can we do to limit those deaths and to limit the suffering that people experience? So, I think that in some ways the heat emergencies are the scariest just because of when those events happen where we have the right conditions of humidity and temperature. We can have really high mortality. And if that event is parked over a giant city like Lagos, Nigeria, you can have tens of millions of people die very quickly. And so mitigating the effects of that, I think, are going to be incredibly important. And ways to cool people's homes efficiently and cheaply are going to be probably the biggest thing that can impact that. On sort of the broader side around infectious diseases and the impacts that those have, a lot of it is going to be strengthening of overall health systems, because the less infections people have, the less severe infections they're going to have, regardless of climate change and so forth. And on the disaster side, work that we can do to figure out how to pay for the costs of greater numbers of disasters in the future. Like right now, our humanitarian system is stretched already. It doesn't have enough money. The World Food Programme's new leader, Cindy McCain, just said that they are $23 billion short of the money they need to actually feed all of the people in crisis situations around the world right now. Where is that money going to come from in order to actually pay for the additional costs that climate change is going to bring? And we're going to have to think of some very creative ways in order to do that.
I want to just add, I want to unpack my tiny answer a little bit, if I can. So I think the investments that are required is something I wanted to just put a pin in here, because the toll of climate change to our national economy is in the $150 to $400 billion a year of costs to our economy from current climate and weather disasters. And so we can pick that number up against many of the other contentious issues around how we spend our money in this nation, and it's of that magnitude, right? It belongs on the table as a decision point for what our leaders are doing to make sure that that number is not growing dramatically through time. And this is, of course, exacerbated into the many, many hundreds of billions on the global scale. So this is a leadership issue. It is a policy issue as well. And so when you have the ability to right size the economic investments into adaptation, recognizing that private sector funding to climate tech and carbon tech right now is in the billions of dollars per year in private sector funding, it's going to take the public sector and policy and leadership and investments from the public sector to make sure that these damages and losses don't escalate dramatically. And keep in mind that if we think a 1 degree, 1.2 degree sea world, which is where we are now, is ugly, think about where we could be with 3, 4, 5 degrees Celsius. So yes, adaptation, but we have got to keep our eyes on emissions reductions so that we do not bake in that horrorscape that's waiting out there in our future at a 3, 4, 5 degree C world. So that's why this issue about leadership, and U.S. leadership goes a long way. So yes, there's a global issue here, but we need aggressive U.S. leadership on this, and that's why I say vote. Thank you.
Okay, let's open it up for questions from the audience. So we have a mic.
Somebody can borrow mine.
Yeah, anybody have a question? Batul, you have a question?
There are mics in the ceiling, so you don't even need a microphone. They can just actually talk. They've got mics.
He wants to run, and
Your name, please.
Hi, Kate Moretti. I'm affiliated with the Department of Emergency Medicine. I have a done. I have an economic question. So when we talk about the economic implications of the health outcomes from climate change, one of the things I see over and over again is that we get a laundry list of effects, right? It affects cardiovascular disease and renal disease and supply chain and healthcare industry. Is there any work being done to quantify that as a whole and to give us a more singular number to use at the policy level?
Yeah.
Healthy kind of.
Yeah, I'm not sure actually. I don't. That's a great suggestion. I'm not sure if there is. I'm not aware of any work that's doing something to provide one number. I think what's interesting in some of the work that I have seen is where people talk about solutions that that address both problem. I guess thinking of how health systems can achieve or mitigate their effect on climate change, but also address some of think about how they can also improve universal health coverage or improve outcomes. So where there's like double wins, I've seen that. So for example, thinking about what are interventions that can make populations both healthier, but also be help in reducing greenhouse gas emissions, or where can we introduce like solar panels to provide both energy and do it in a way that's sustainable in countries that don't have sustainable energy to power some of their clinics. So I have seen, again, that's not one number, but also looking at, I guess, double wins where we can think of achieving different aims of the health system as well as thinking about how we mitigate the effect on climate. So that's not exactly answering your question, but yeah.
I have another non-answer, which your answer was much better than mine will be, but mine is even worse non-answer, which is another way to approach that that I really like to discuss with whoever will listen, is the toll that air pollution is, of course, taking on our economy every year. And so that is, I guess, easier to measure. I'm not the expert, but I've heard a number of $800 billion cost to our economy from exposure to air pollution every year. And so, and again, that's a very large number and will stack up against many of the other policy priorities at the national and even very local levels in some cases. So that's a number that has a lot of resonance, and I think we've seen the success in the current administration in DC for just how far you can take that argument in articulating the co-benefits of a transition away from a fossil fuel-based energy economy into one that's a renewable-based and lower carbon, lower air pollution. So I think, continuing to make sure that we are building that case and refining these numbers and lifting them up as opportunities is a huge part of this argument in terms of the economics of the situation.
Other questions?
So,
Hi, I'm Otto. I'm a senior in Professor Aubert's class. I'm in the undergraduate program here at the School of Public Health. My question was more about lower middle income countries. My understanding is that the vast majority of carbon emissions come from industrialized nations, and that the effects of those are largely being held by these lower middle income countries. How is climate change and the impacts of health in climate change being affected and affect lower middle income countries, and what can we do from our perspective in the United States about that?
I'll start. So you're right on in that despite the fact they've contributed very little or much less than in high-income countries to global emissions, low and middle-income countries are going to face the worst of the brunt of climate change over the rest of the century. And that has a lot to do with, that piece that I talked about at the beginning, with a disaster being not just about the natural hazard, but about the community's ability to cope. And so for many of these communities, their vulnerability is high and their resilience is low. And so a natural hazard of the same magnitude that might not actually cause so much damage or kill so many people here in the US would cause a lot of damage and kill a lot more people in a place like sub-Saharan Africa or South Asia or Southeast Asia, et cetera. And so I think, there is a moral issue here around the fact that those countries that caused climate change need to actually respond to the negative effects of their of what they've done on the countries that will be suffering in the future. So, we finally, after many, many years of many advocates pushing, had some movement on the idea of loss and damage at the most recent COP. And, hopefully that will be built into something where countries that are going to be impacted in the global south will actually have funding to help them adapt and to help them recover from disasters. An even simpler thing, which there's a great push for right now, is suspension of debt repayment. So many of these countries in the global south are paying large debts back to countries in the global north, and they experience a disaster like a hurricane or a famine, and they still have to pay the service on these debts and aren't able to use the money to help their populations recover. So even just rich countries having a rule around suspending debt repayment when a disaster strikes or when a country is experiencing the negative effects of climate change in the future would go a long way to helping those countries recover. But I'm hopeful that we'll see this, and probably the closest thing we'll get to reparations, but it is in the works.
Another question, Tanya.
Yes, hi. I'm a research assistant at the School of Public Health, part of the Dean's team. Work with Irene. So a question, it's similar, but it's more coming from the low and middle income country government perspective. There's been like a huge shift towards like the sustainability of humanitarian efforts and like embedding efforts being funded by more developed countries and lower middle income countries, and making sure that local governments are involved in that. And I'm just wondering, although the idea of reparations is important, because obviously the impact is not, the emissions aren't coming from the lower middle income countries. How are we creating incentives in those local governments too, not just getting the money into the countries, but also creating incentives locally and incubating talent locally and innovation there to make sure that the solutions we're coming up with in those countries are their ideas, I guess. So I'm wondering, have you had any experience with such initiatives to create incentives in those governments locally, and not just at a UN level and being kind of imported into those countries? I'm not sure.
Tough crowd.
Tough question.
I mean, I am not familiar with the global context. All of my work is nationally. But I do think that it is through these kinds of replicable, scalable frameworks where we can have cross-sector partnerships that are enduring that are going to be the key here, so that we can really move to a model of co-developing solutions with the most underserved, vulnerable communities. And there's for too long been like an aid paradigm or a parachute kind of mentality where we're going to come in and fix your problems or give you some money. And oftentimes my own experience working with underserved communities on the front lines of climate change in the U.S., I think, are lessons that do in some ways translate or have resonance right at the global stage, which is it is really only through the co-development process and sustained partnership where there's an equitable foundation for solutions making, right, that recognizes that we may have a lot of resources, but there needs to be a framework for how those are distributed, leveraged, towards what end, with whom, and towards what products and what process. And so all of that is really messy, but that, to my mind, is where the frontier of this solutions making work is really going on right now. And this is coming from the United Nations. It's also coming from the United States Global Change Research Program, which governs the billions of dollars that go to climate researchers in the United States. And they're saying this. They're saying, if you want to, have access to these largest funding opportunities out there, we're going to be making sure that we're working within a framework that recognizes the need for sustained, deep partnerships with the communities that we are pretending to serve. So I feel there's a huge amount of promise in that. I think there's lessons that we can learn from working with underserved communities here in Providence and Rhode Island and New England that do have some resonance, and I'll let you guys weigh in there because, again, I'm not the global person.
Yeah, I would say that I think in general, governments in the global south are highly motivated to find solutions for their populations to the effects of climate change, because unlike us, for whatever reason, they are pretty much 100% on board with the idea that climate change is real, that it's coming, and that they need to figure out ways to adapt their populations to deal with it. I agree with Kim. I think that there's a lot of opportunity for innovation in the global south. We think that we have all the ideas in the global north, and we just need to hand them over to the global south. But really, there's these places that are going to be suffering the most from climate change are the ones that are going to develop probably the most innovative and solutions that will work for them, for their culture, for their economy, for their local society. I mean, I have a tiny example. We have we have 50 global fellows based around the world. One of them, Chinwuke, happens to be a professor of agriculture in Nigeria. We gave her a small seed grant recently where she used it to develop an innovative training program for rural women farmers in Nigeria in order to adapt their farming practices to deal with the effects of climate change, to deal with more variable rainfall, and to deal with higher temperatures, and created a training of the training program that can sort of spread out. And that's the sort of thing that I could never do that, and I don't think actually even somebody who was an agriculture expert here in the U.S. could do that, but that's something that a local individual in Nigeria can do, and we should try and figure out ways that we can provide more support, especially funding, to these local entrepreneurs and civil society leaders, as well as local governments, to try and develop their own innovations.
Well, we are actually out of time. You have one burning?
I'm
You
good, yeah.
Okay. Well, so I would say for those of you who are here, thank you for coming here. Those of you online, thank you for joining us. And for those of you here, stick around. We can continue these conversations during the reception. There's food, there's drinks outside, which is always good. And this concludes this series. Thank you very much.